Greetings, name of the Most High. Today I want to do a video on strokes because I was very disturbed to see a brother, a young brother, 35 years old, Rastafarian. Don't eat no meat, no fish, strictly vegan, had a stroke, lost the whole right side. And one of my good friends saw her yesterday after 2 years in bed with a brain tumor that gave her a stroke. And that's why I'm saying to people every day that we must take care of our circulatory system. And a message to the Rastafarians who don't eat no flesh. If you don't eat flesh and you are what we call an italist, you have to incorporate B12 and the B vitamins in your diet because you don't make it. So please, if you are a vegan, strict vegan, please incorporate the B12 in your diet because it is very essential to prevent pernicious anemia and also troubles in the blood. Alright? Alright, so today we're going to talk about a stroke. Now I had a stroke. About 30 years ago I had a stroke. And Clotel Holder, who's a herbalist, she was there because we used to live together. And she's the one that helped me to overcome the stroke by using acupuncture needles. Alright? And the ambulance came, took my pressure. And they said to me, you have pressure in your family? Yes. Who have pressure in your family? My mother. You were next in line. I said, oh, woo! I have to change, man. I changed everything. And I changed it around. My mom died from a stroke. She had 2. So I could tell you what it is. You can't talk. You get dizzy. One eye become blurry. Then the 2 eyes become blurry. You'll have weakness on one side of the body. You can't speak. You can't understand when people are speaking to you. Those are signs that you're getting a stroke. Don't get it. Because you become dependent on people to take care of you. And that's the reason why I teach so adamant to take care of your bodies. And when things happen to poor people, they suffer because they can't travel. And that's the reason why I come to the poor all the time. Alright? Now, over here. Strokes is called a brain attack in the brain. You have what we call an ischemic stroke, you have transient ischemic stroke, and you have arterial dissection stroke. And you have stroke that come from hemorrhaging in the brain. Vessels are all messed up. That's where you get strokes from. The cerebral embolism is when an air bubble moving through your body in your bloodstream from any part of the body could give you a stroke. An air bubble could cause a stroke too. Then you have the cerebral thrombosis. That's a blockage in a vessel or an artery leading to your brain. That's called a cerebral thrombosis. Then you have what we call this transient ischemic stroke. That's what I had. It's a mild stroke. And it goes away in about 24 hours. So I had to learn from that now. And then you have the arterial dissection stroke. And that is when tears develop in the lining of an artery and allow blood to get between layers of your artery. And that is caused by injury. Different type of stroke. And that's why you have to take care of the circulatory system over here. Because when you get older, you're going to get old now. Don't forget, you're going to stay for 35 and 25 forever now. You're going to get older. And when you get older, the older we get is the harder the arteries become. And once the arteries become hard, then you start to get more plaque in the walls because what you've been eating before catches up with you long term. And then once the arteries become hard because of age now, and you have start to get plaque in the walls, you start to get what we call osteosclerosis, then all these veins and capillaries and arteries become clogged up. You get varicose veins. You get troubles in your heart. You see what I'm saying? And then all of a sudden now, the carotid artery that leads to the brain is being cut off from nutrients and blood and oxygen to the brain. You get what we call a brain attack, a stroke we call it. That's what it is. So you have to take care of the circulatory system. Very important. You have to have the blood moving quick. You must clot because clotting is a natural part of the body. When you get caught, you must clot. But if you have clotting where it's affecting the whole circulatory system, then you are prone to getting a stroke. Over here now. When the doctor takes a CBC, complete blood count, he is looking for what we call your white blood cell, red blood cells, hemoglobin, with them here, and then look at the band cell over here. If the band cells are low, they look for leukemia now. This over here, now the platelets is important because your platelets go from what 150 to 450. And if the doctor sees your platelets is rising over 450, he become concerned. And then he will say, uh-oh, you look as though you're having clotting of the platelets. We call it platelet aggravation. And then he will put you on blood thinners now. He don't fix it though. And then you can't eat no green food because they clot the blood. See? And you got to take that forever. But no, if you don't have, follow here, if you don't have good stomach, digestive health, and you don't have good liver health because your liver has the clotting factors, globulin. Your liver does that. So you must have good liver health to have good clotting factors also. And a lot of people have bad livers now. See? So once you have good elimination, and you have the blood moving because the blood is your life now, and the blood is moving well, you can never ever get a stroke. Then you have air bubbles now. If you have a lot of gases in the body, and you have air bubbles moving from your body, it gets into the brain and give you a stroke. If you have a vessel in the brain that is bulging, called aneurysm, or you have hemorrhage in the brain because of bad habit, you're not feeding the brain nothing, then you will get a stroke out of hemorrhaging of the brain. They all call a stroke. And then you become dependent on somebody to take care of you. And that is the reason why I'm teaching people every day to take care of the circulatory system and the brain in order to prevent these things from happening to you all regularly. Let's go to some herbs now. See my food here today. Navy beans. Pumpkin. I don't get no stroke from that. I don't eat no fried foods now. Look at the fried foods. That's my lunch. Nothing after that. I'm going to get no stroke now. Because I had one before. I could tell you. Who feels it knows it. I felt it. So I know for a fact I don't go back to the same way of eating. Like I had a cancer patient today. Breast cancer patient come to me today. She had took off her right breast. And the doctor said to her, oh, go back and eat anything. What can I eat, doc? Go back and eat anything. Now the cancer went into her left breast. Because she went back eating the same foods that gave her the breast cancer in the first place. We have to learn these things. You cannot go back. You have to go forward now. Ginkgo, Collinsonia, rosemary. You see this herb here? Collinsonia, the second one. It helps with what you call vascular integrity. It strengthens the veins. It strengthens the arteries. So when the blood is moving fast, it don't collapse. It moves things out of the bloodstream. It moves plaque out of the blood. All that's done, but it sends oxygen to the brain and nutrient to the brain with ginkgo and help with memory. Rosemary is an antioxidant. Vitamin A, vitamin D, all the antioxidants we need for the brain. Works. Rosemary have them. We don't use them. They're found in nature now. Not warfarin and coumarin. This is the herb we use now. Lemon balm, hortan, cinnamon, ginger. They all work with circulation. Move the blood. This one here called cinnamon here. Prepare circulation. Garlic. Remove plaque from the walls. Huh? Onions. Remove plaque from the walls. Huh? You understand? Lime, lemon brown. Move plaque from the walls. Clean it up. You don't get a stroke. They don't tell you that though. They tell you to get sick and come to them. Sick care system. I do the healthcare system. Go to Kola, Kisandaberry. This herb here, it's a very important herb for the central nervous system, but it also works in the endocrine system. Kisandaberry. You must use them together to avoid these troubles in the brain. DHA, GABA, choline, and L-theanine. They're all found in the brain. We all need them in the brain. We need them in the brain. And the pork don't have it. Fried food don't have them. Barbecue don't have it. Ham don't have it. Bacon and eggs don't have it. Nutrients like vegetables have them. Grains have them. Nuts have them. Seeds have them. That's what they're for. That's what God gave us to eat in the beginning. These kind of food like that. To get these vitamins and minerals for the brain now. That's what we need. B6, B2, and magnesium found in the hippocampus of the brain. That's what we need. That's what we need. And if we don't take care of our system, the circulatory system, we're going to have problems. Serious problems now. All right? So, people, in the name of the Most High, start getting your circulatory system in order. Stop eating the fried foods. Stop eating the greasy foods. Take time and rest your organs. Clean them up. Take care of the heart. Prevent high blood pressure. Prevent diabetes. And then you will see for a difference and go into nature and look for all the things that God put in nature for us to use. And then you will see automatically your blood will flow well. And you will prevent the stroke. Give God the glory every single day. Because He is the Most High. And He is the one that gives us all these cures that are found right in nature for us to use. Give thanks and praise to the Most High. Blessed love.